Hi, everybody. My name is Maureen, and I am an attending physician at Memorial Hermann, the Woodlands. And I often give a clinical lecture called Separating Drama versus Trauma. But this lecture is specifically for scribes, and I would like to discuss drama and trauma. This one's a little bit on the other side. It's about how to handle what you see and feel in the emergency department. And Dr. Chris Hong is also involved, and he has helped me put together some information on kind of what we do in these situations. So, as a scribe, you will see awful things. You will see things that normal people don't see. You will see dead people. You will see dying people. You will see assaulted people. You will see assaulted children. You will get used to seeing mangled limbs, horrified families, wailing mothers, psychotic people, and probably anything else you can or can't think of. So, what usually happens after you see a traumatic event like this is you ignore it or you try to tamp it down, and that will always come back to haunt you, literally. So, let me read through a little bit of a scenario here. So, you just walked out of a level 1 trauma with the physician you're working with, and they sit down, put in orders because their brain's going 13 different places. They're going to look at the CAT scan, and you start working on the chart. So you're trying to work on the chart, but your mind might be occupied with what you saw and what you feel about what you saw. And the next thing you know, your doctor's like, okay, let's go see the next patient. And you're like, what? Oh my God, I can't sit down. I can't figure this out. And so you can't stop thinking about the trauma patient, the critical patient, the patient who died, the assault patient, whatever. And you just keep going, and these things pile up and they keep going, and you have to keep going, right? It's your job. And even though you are only a scribe, you are an integral member of the medical team. But if you aren't taught to sit down and process what you feel. So then you just go home, you cry on the way home, you don't cry on the way home, you never think about it, you don't ever deal with it because you don't have a way to deal with your feelings. You don't know how. So, what needs to happen is you talk to somebody. That's how it starts, right? Maybe it's your doctor, maybe it's the chaplain, maybe it's a nurse you've bonded with, a tech you've bonded with, a housekeeper, anyone. Maybe it's a different doc on shift. Maybe it's me. You may not be able to take the time right away, but before you go to sleep, you really should talk at least a little. So we're taught to roll right by tragedy because there are other patients to see, other charts to do. But if you don't feel, you don't heal. So these skills are not only helpful as a scribe, but these skills will benefit you in any profession you choose going forward. So how long does it take to deal with these internal feelings about the situations? Sometimes it might only be a minute or two to decompress. Some cases take a lot longer, or even multiple conversations with doctors, with fellow scribes, just with people who've done this before. We are available. I have a scribe mentor group now that is available for this specific thing. Any questions you have, we're available. All you even need to say really is, listen, I feel really shaken up after that trauma case, whatever. Could we find a minute to chat before we go home? And if they say no, find somebody else. Okay, that's where you take ownership, you take responsibility. And if that still doesn't happen, you can text me or call me or Dr. Hong. And if we don't answer and we're sleeping, we will definitely get back to you, but we are available. And even if you don't see how that patient or situation has affected you, every patient you see really does have an effect. And the biggest takeaway from this entire presentation is that you are never alone.
All right, so my name is Jacob. I've been a scribe for actually about 4 years now as an ER scribe, and then also as a trauma scribe more recently. So when I first started scribing, 4 years ago, about 2 months into my first real getting into it. So after I've already done all the training and whatnot, we had a call from an EMS. This is out in East Texas, that they were bringing in a drowning patient that was, I think, 6 or 7, something really young. And of course, being at that it was like rural Texas, it was like a 45-minute transport time. So they've already gotten close, and this patient's been down for already, I think, close to an hour now. We get them in, and of course, family's there, all that, and it's pretty grim. But because it's a 6-year-old, we work them up, and so I think like labs were they were grim. I mean, I think his pH was like less than like 6.9. So like, I mean, we're talking there's just no chance on this guy. And so we do everything. We actually worked him for about an hour in the ER, so like 2 hours of downtime. So it's already, pretty bad. And we pretty much do all this because like we're in the patient's family, and we want to show them that we're like doing the full work and all that. And so of course, eventually we call it. And I know the other scribes in this group, when there's nothing worse than hearing like a family after they've like experienced a loss, and especially like a mother, that's like you can kind of like hear those screams in the back of your head all the time. It like kind of haunts you a little bit, right? And of course, it's a pretty busy ER, and so we get another call from EMS. This time, this is an infant baby who came in for respiratory distress. And so all this is happening. We got 2 very sick kids. And like at the same time, I'm brand new to this. So it's like all these things are just running through my head at the same time. And like I don't have any time to really even think about the first one. And now we got the next one coming in that unfortunately also died that night as well. So that day was pretty rough, obviously, right off the bat. What I did to kind of like cope with that, looking back now, is not the way to do it, but I just, kind of shut down with myself and, left work, went home, didn't really tell anyone. The next day, didn't really tell anyone, and didn't really get like the courage to talk about it for like another week with like just friends and family. And so for me, that was always a struggle that I had, was, reaching out to other people and talking. And so thinking back, the biggest thing that I would recommend to anyone is just reach out to someone. What I wish would have happened was like if one of the physicians or one of the like nurses would have kind of sat down with me and had that talk, or at least just debriefed a little bit on what it is, that what happened and everything. Because I was so new to all of medicine. I'd never seen any of this before. So when I see someone who's been worked up for an hour outside of the hospital now, I am well aware that that patient's probably not going to make it. There's probably like a less than 1% chance. Back then, I was, oh, we're heroes. We're going to save everyone that comes through the door. So that's something that I wish I did, was kind of reach out to that physician and really talk to them and figure out what they were thinking of. So, yeah.
Yeah.
Awesome.
I definitely agree.
Thanks.
It's such a tough situation. It's, yeah. I've got something kind of similar, but I'm Farhan. I worked at a level 3 trauma center before I started working at the Woodlands, and I was regular scribe, and then I was the chief scribe at the Woodlands for a bit. One of the big things that kind of still sticks in the back of my head is like the first patient that we saw that unfortunately passed away. It was when I was still at the 3 trauma center, in the same system, and it was kind of, I didn't really know how to react to something like that, right? Because I definitely have been in situations where like undergrad, and there's obviously like tons of unfortunate things that happen, and I've kind of been faced with death before, but not directly as I was, being in the ER, being in the same room. Whereas we had a patient come in that day. I want to say it was a couple weeks into me scribing solo. Like I just been on the job. I basically just seen like the bare minimum stuff, people coming in say, wait, this is definitely pre-pandemic. But then we had this call come in, EMS, patient was found down, and they were right outside of the hospital. So EMS brings them in, and we basically start the full workup, right? We're working in a level 3 trauma center, so there's not a lot of like staff availability. So whenever something critical does happen, everything else kind of stops in the hospital, right? So everyone's in that room, all the nurses, they're going by and, you know, doing their rounds of CPR and everything like that. And there's a lot of change going on, right? Because you're standing in the corner, you're kind of the fly on the wall observing everything that's happening, because in part that's your job, but also you don't really have the formal training, or you don't have the designation to do anything in that situation. And then whenever we ultimately did call the time of death, it was those words still haunt me in the back of my head. It's just, you know, the time of death, and you kind of see that all the efforts that everyone's doing, and then you can see kind of almost immediately how everyone's mood kind of changes, and it becomes a very solemn situation where not much is happening. And my initial reaction to that was actually anger, which is definitely a weird emotion to have after something like that, where sadness wasn't the first thing that came to my mind. I immediately got mad at myself because I couldn't help in a situation where I was directly involved, right? And just being in a situation where you feel useless, and obviously you're doing what you can, right? You're doing your job, and your job only goes so far. But one of the things that kind of helped me kind of understand the situation was learning what was going on, learning how things work and how protocols are kind of carried out. And I guess I approached it from a very technical aspect, where I kind of wanted to learn more about the situation and kind of the causes and things, and how I could help stop situations like that. Obviously I can't, right? Because, you know, no matter if I get a CPR certified, or if I, you know as much as I can, I'm not a physician, I'm not a nurse, I'm not someone who can directly impact patient care. But I think kind of learning the situation and learning how, you know, the heart works and how the body works and everything like that, it kind of puts everything into perspective, where you can feel like everything was done, where you see these physicians spending time and, you know, hours. You stand inside of that room during a code for an hour and a half, and it feels like 10 minutes. You walk out, and, you know, 2 hours has gone by, and you're not even sure what happened in that time. It's really just like a blank area. You're not really sure what's happening. And whenever you come out, it's okay to, you know, kind of feel these emotions. And, you know, different people cope in emotions differently. Where Jacob felt kind of blank and numb about it, I immediately got mad at myself for the situation. And through that, I think it's given me a drive to want to learn more, become more, and kind of do more. And it kind of these are situations that I think back about, and I have a little journal where I write all these like interactions and my reflections on patients like that. And I think going back and kind of understanding my emotions and reflecting on them, but also giving myself time to feel those emotions, that's definitely helped me out, and definitely given me a forward direction whenever stuff like this inevitably happens in the ER.
Definitely,
That's awesome,
I feel
friend.
like writing stuff out has helped me. So hi, I'm Camilla. I've been a scribe for 3.5-ish years. And I really had no medical experience before scribing. And so I came in completely like, we're Grey's Anatomy. Yeah, it's not. But one situation that really stands out to me was actually maybe 2 months after I started, and it was actually the night of my birthday. We got a call for a self-inflicted gunshot wound. Now, at this point, I had seen other traumas. In my life prior to being in the hospital, I'd seen traumas happen, and I was okay with the like blood, the gore, the awfulness. But this case just really hit home because they wheeled in this guy. He was somewhere in his 50s, and he had tried to kill himself by taking a shotgun and putting it under his chin. However, the way he angled it, it did not hit his brain. It just blew off his face. And for me, seeing them roll in this guy and place him on stretcher, at first I was like, okay, this guy's probably not going to make it. Like, he wasn't moving. But as they hooked him up, I realized his vitals were fine. He was breathing on his own through the trach. And then he woke up. And I just remember the sound of him trying to yell. And I just felt this absolute horror that this guy was awake, alert, and aware of his situation. And it was one of those life-changing moments for him. His life is never going to be the same. And that's something you see in the ER a lot, life-changing moments for people. And I remember after we did all our workup and walked out, the physician I was working with, he was actually new to our facility, and he pulled me aside, and I thought he's gonna like help, like talk to me. And he asked me if I was okay. I said, not really. And he told me to get over it. And after that, I was just like, so like in shock by him, by the patient. I just went completely numb. I can't remember the rest of the night, really. I was just like a machine, just did my job, just kept going, complete the work. That night when I drove home, I remember pulling over into a parking lot halfway home and just bawling my eyes out. And even though it was like middle of the night, I got home, I woke my mom up because I live with my parents, and I was like, I need to talk to somebody. And so she got up, turned on all the lights, made a cup of tea, and we talked. And that was the first time I like had to like go to somebody and be like, I need to talk about how I feel about this situation. From that, I learned how much it helps to connect others, to express and have your emotions validated, that it's okay to feel this. And so definitely that, like, I wish I had known this earlier, because there are other cases I could have done this with. And forward, I know that I am not alone. We often feel like we have to do everything ourselves, but in the ER, everybody works together. You can talk to the physician, other scribes, nurses. Finding somebody to share your experience with and know that you're not alone really helps you cope with what you've seen, and just helps you continue on with your job.
Wow, good job on asking. All right, G.
Oh man, that's gonna be hard to follow. Understanding like the validity of people's feelings and everything, I feel it's like a huge unspoken component of what we do. I'm Gerpany, by the way. I go by G. I've been a ER scribe for 2.5, going on 3 years now, I believe. But in my experience, the first interaction that I've ever had dealing with something that shook me to my core would have to be during one of my trainings. Initially at the site, we got a call from Life Flight saying that there was a MVC that they were bringing in, and this person was pinned basically between the car and a tree. And I think they ended up doing an amputation on site just to get her free. And when they brought her in, like the extremity was separated from her, and that really threw me for a loop because I've never seen anything remotely close to that. It was just shocking. The trainer didn't say anything to me. The trauma surgeons were already there. They evaluated the patient, did what they could, took him to the OR and everything. But at the time, it was so fast. Everything happened so quickly while I was training, and I had never expected that to be like possible during a training shift, let alone have to go through it myself. And as soon as we walked out, like the trainer turned to me and said, "That was so cool, wasn't it?" And I was like, cool is one way to describe that. It caught me so off guard because that's not something you ever expect. But then moving forward into my scribing years later on, especially working during this pandemic, what really emphasized this whole validity that Camilla was talking about was when we had a person that was younger than I am, in their 20s, come to the ER with COVID back when COVID first hit, essentially. And I was working with one of my favorite doctors at the time, and she went to go and evaluate the patient. It was like desatting really bad, and eventually ended up passing in the COVID area. So at that time, scribes weren't even allowed to go back there. So I actually didn't go with the doctor, but when she came back, she spent about an hour in the room with the patient trying to save them, and she was unsuccessful. She came back and like sat down and was just in complete like shock, basically. super angry, super mad because this person is young, and you try to save every patient that you can. And I think that's something we all just expect to happen all the time whenever we go to work. You try not to lose anybody. But in this particular case, she walked out after spending like an hour in the room. I was just working on charts at the time. And for me as a scribe, I didn't understand like whether I should reach out to her and say something or if she just wants some alone time, because I've never been in a situation to where I'm the one who needs to comfort somebody else, especially somebody who does the actual working aspect of what we do. And all I'm supposed to do is charting, essentially. But I built up a friendship and confidence to talk to this provider. So I asked if she was okay. I asked if there was anything I could do. And she just asked for a couple of minutes. And then she said she'd give me the report about what happened. And then over the course of the rest of the shift, she slowly got back into it, became herself over time. But I knew it impacted her, and approaching her in that situation was something that I think was like the right thing to do in my, like, retroactively speaking, but also something that I feel like isn't done enough, like checking in on each other in an ER setting. But for me personally, the biggest thing that happened, which Farhan's in this call, and I want to give a shout out to him because he completely changed my perspective. Because after scribing for about 2 years, I will say this with complete honesty, I became sort of desensitized to the patient aspect of it, to where we'd have patients come in and eventually like we'd run a STEMI, they didn't make it, and that's it. But I had one shift where Farhan was there with me, and we were working with another one of our providers at the site. And we had this middle-aged lady come in who was having a STEMI, and EMS brought her in. We saw it was a textbook STEMI. I still have like, I can still see it vividly in my head. And Farhan was like bored, I guess, that day, considering he had already wrapped up his charts. So he came with me to go see the STEMI because he wanted to read the EKG. So it's me, the provider, and Farhan, and they roll her away straight to the cath lab, and we're just standing there. And I'm looking at the EKG, and I was like, cool. And so 5 minutes go by. She ends up passing away on the cath lab table, and we get a call, and we're like, oh, she didn't make it. And then I'm sitting there and I'm talking to the provider, and I was like, oh man, okay, we got to go see these other two. And then Farhan turned to me and he said, isn't it crazy to think about? And I was like, what do you mean? And he was like, we were some of the last faces that lady saw before she ended up passing away, like complete strangers. And when he said that, I got goosebumps. I was like shook to my core, because that aspect of I'm just a scribe, this shouldn't be like, it created this passion, it created this spark again for me that, oh, I'm not just a scribe, like things that I do sort of have an impact around here. Like I need to have more of a passion and a drive to be more of a people person and not just focus on what I'm there to do.
You definitely matter, G.
Farhan for that one. Crazy.
You matter me. Hey guys, my name's Garrett Leach. I have been a scribe was a scribe for over 5 years in a number of emergency departments and in some outpatient settings. And I was all these guys' bosses.
Including me, yeah.
Yeah, not you.
No, I said including me.
Yeah.
Soon.
So I think everyone can talk about like a number of tragedies that they've witnessed. And I don't think I really got good at handling those. But there was one in particular where that I feel like I can talk about and hopefully like pass on a lesson there. So there was a lady who came in with her kid with Downs, who's like 1.5, is a toddler. And she was like, oh, she'd been throwing up for a couple of days. Don't really know what's wrong with her. Was going to take her to the pediatrician today, but couldn't get in, so I just brought her here. And so we do the initial evaluation, come back out. We're standing in the hallway with her, and whenever she comes in, she's blue, and she's not responding. And so immediate, like everyone's running around like crazy. So the doc and I step out into the hallway, and he's asking her about more details on the situation. And it turns out that she was fine whenever they first got in the car, but in the process of the ride over, she aspirated and she choked on her own vomit. And because she was so young, couldn't roll over. And so she had died in the car on the drive over. And the doc and I were just like sitting there stunned, staring at her. And at this point, I'm in the emergency department for 4 years. But I like start tearing up and start to feel ridiculous about that, especially considering everyone around us right in front of the patient. But I noticed that the doc is staring at her, not able to say anything either. And he had the same reaction. Anyways, went through the rest of it, called it, and eventually kind of went along to carry on with the rest of the shift. And previously, what I would have done was just kind of go through the rest of the shift in a haze. But that time I decided to take a couple of minutes for myself, and I went to the bathroom and I just wept. Taking that time to kind of, even in that short amount of time, to decompress, work through that, what I just witnessed, allowed me to kind of be more active on the job and be able to do things for the patients that we could. And beyond that, after getting home, there's a lot more mourning of that. But Camilla and Gerpany, like everyone said, the point of what we're trying to say is that it's okay to mourn, and it's okay to process these very difficult things, even for people that you don't know. Those are, you, in that short amount of time, you've had this huge impact on this person's life. And it's okay to get emotional about that. And it's okay to have difficulties processing those feelings. And just kind of generally looking at, if this is okay, is it okay if I do like a quick general stress kind of work through thing real quick?
I would love that. Perfect.
Okay, so working in any hospital setting, working in the emergency department especially, it's important to manage stress every day, not just on days where you see a tragedy, because you're dealing with people at their worst. Like, no one comes to the emergency department because they're having a fine day. They think it's the worst day of their life. So that stress can compound on you very easily. And it did to me, and I'm sure it did to everyone else here. And I worked the night shift for about 2 years. And the first about year of that, on days that I would work, I would just drink. And that is a bad coping mechanism. And what I've found through Gibby here is that there are very healthy ways to work through these things. And the number one thing with that is finding consistency in something, whether it's reading, studying, exercising, anything that you can do on a daily basis that allows you to kind of help work through things and process. That using that and building that skill, that's going to be invaluable for you. And yeah, that's really all I've got. You're a part of the medical team. It's okay to feel things. and, you know, get a coping mechanism that isn't destructive.
That's awesome. Thank you much to everyone. I appreciate all of you. And for those of you listening, we appreciate you too.